all know that hearing from our students and how what we teach them helps them is probably one of the most rewarding things that we can ever do. I want to share a story that I will always treasure, and I think is probably, as an educator, one of the most rewarding things that has ever happened to me and my team, because I can't take credit for this alone. So this occurred in simulation, and we have taught our students, how do you take things up the chain of command? What happens when things aren't going well at the bedside and you have to use your judgment, that critical thinking and clinical judgment, to decide, am I going to escalate this up? Am I going to intervene and make that call to the physician and really say, you need to come and see this patient? Because, that's a scary thing for our young students and our newly graduate nurses to do. So we really worked hard with our students, particularly in their senior year, their junior and senior year, to help them understand and differentiate when they should call a healthcare provider and how they should do that. And we taught them this acronym. We call it the 3 W's. What I see, what I'm concerned about, what I need. And we taught them how to paint this picture, because the person, the healthcare provider you're talking to on the phone, doesn't always see what you see. So we taught them, we role-played it, we did it in simulation, and then we send them on our way, and we don't always hear back from them. But we got an email from a student who told us this story, and it brings tears to your eyes and makes you just be grateful that you take the time to do this. And she told us about a situation. She was in a pediatric unit. She was newly off orientation, taking care of a young pediatric patient on the night shift, of course, when there's fewer support around, and her child was not doing well. And at first she started to panic, but then she said she remembered what she learned in simulation, the 3 W's. So she did her vital signs, she did a good assessment on her child, and she picked up the phone and she called the healthcare practitioner and she used her 3 W's. She picked up the phone, she called her healthcare practitioner, she used the 3 W's, and she said, this is what I see, this is what I think's going on, I really need you to come and see this patient now. And she was so articulate in what she did, even though she was kind of shaking inside. She shared with us that the physician came right away and saw the patient. They were able to get the patient what they needed, and she felt so good about that. And she shared that with us, and it just made our whole team feel really good about what we did. So it's always so nice to hear that from our students, that yes, we can teach them these things, and guess what? A few days off orientation, they remember it and they can put it into practice. Because we didn't just teach it from a book. We actually had them do it and practice it in the lab, as tough as it is. And they can pull that together and they can do it, and that is so important. Yes, it's important to pass the test, but it's so much more important for them to put that clinical judgment into use for the safety of our patients.